Hello, this is a presentation for the study entitled Sleep Quality, Anxiety, and Depression in Women with Overactive Bladder, Preliminary Results. Here are our affiliations. And just for a background and context in the following study, it is known that the symptoms resulting from overactive bladder have a negative impact on the physical, emotional, and social aspects of the affected individuals. Nocturia is responsible for the sleep interruption of affected patients and is one of the most frequently reported complaints by them. So given this information, the hypothesis arises in the study that women with overactive bladders are more affected by symptoms of depression and anxiety in addition to having a worse quality of sleep. This study aims to compare the quality of sleep as well as the frequency of anxiety and depression among women with and without overactive bladder in the period from October 2019 to March 2020. This is an observational cross-sectional study with two groups, a study group, which will include women with overactive bladder aged 18 to 65 years old, and a control group, with women aged 18 to 65 years old with no report of urinary urgency confirmed by the International Consultation on Incontinence Questionnaire of Overactive Bladder, the ICIQ-OAB. This would mean they would have a score equal to 0 on this questionnaire. Women would be excluded from the study if they had a difficulty in the comprehension of the study steps, if they had any type of cognitive deficit, an overactive bladder due to neurologic defects, lower urinary tract infection, a sacral or tibial region sensory deficit, deep venous insufficiency, if they used pacemakers or implantable cardiac defibrillators, or if they were pregnant. So participants would have to sign the free and informed consent form, and the study group would have to perform a 3-day voiding diary. Both groups answered the following questionnaires: the International Consultation on Incontinence Questionnaire of Overactive Bladder, the Pittsburgh Sleep Quality Index, the Hospital Anxiety and Depression Scale, and basic sociodemographic and anamnesic data. For the preliminary results of the study, the sample consisted of 14 women in the study group and 6 in the control group. The median age in the groups were 46.5 years in the study group and 33 years in the control group. For the preliminary results of the sleep quality assessment, the mean score of the control group was 7.33 with the standard deviation of 2. And for the study group, it was 7.43 with the standard deviation of 2.1, with no significant differences between these two scores, considering that a score from 5 points up already altered sleep quality. So both groups conveyed this alteration in sleep quality with no significant differences. The anxiety diagnosis was found in 1 patient of the control group and in 6 patients of the study group, with no significant differences between these results as well. Depression was not diagnosed in the control group, and only 2 participants of the study group showed this disorder, also a non-significant difference. So in conclusion, our results could not find any difference between women with overactive bladder and without overactive bladder and the alterations of anxiety and depression symptoms or sleep quality in them. But it is possible that because of the small sample size in our study, that more patients would be needed to detect the difference if it indeed was there. Thank you so much, and feel free to comment and give us feedback in the comment section below.